Liver 1 is the lateral nail point of the big toe. Be careful not to confuse it with spleen 1, that's the medial nail point of the big toe. Liver 1 is the lateral nail point of the big toe. Liver 2 is located half a cun proximal from the edge of the web margin between the first and second toe. Liver 3 is located on the dorsum of the foot in a depression distal to the junction of the bases of the first and second metatarsals. You can palpate up this nice cleft between the two bones. Don't go right in between the two bases, just go a little bit more distally into where there's a nice dip. It's almost on a level with spleen 3. Liver 4 is located in a depression directly anterior to the prominence of the medial malleolus, but medial to the tendon of tibialis anterior. To bring this tendon into relief, dorsiflex the foot. So if you can relax. Don't confuse this point with spleen 5, which is much lower down. It's directly anterior to the prominence of the medial malleolus. Liver 5 is located 5 cun superior to the prominence of the medial malleolus, immediately posterior to the medial crest of the tibia. Mark this point in between the medial crest of the tibia and the gastrocnemius muscle. There's often a nice notch in the bone just at this level. Liver 6 is located 7 cun superior to the prominence of the medial malleolus, immediately posterior to the medial crest of the tibia. If you're having problems identifying the medial crest of the tibia, just raise the leg slightly so the flesh falls away. Liver 7 is best found in relation to spleen 9. Palpate posteriorly along the inferior border of the medial tibial condyle for about 1 cun posterior to spleen 9. There's a nice dip that's liver 7. The easiest way to locate liver 8 is to fully flex the leg, place your finger on the medial end of the popliteal crease, open the leg up to 90 degrees and then travel slightly superiorly, that's up towards the head, a very small distance until you fall into a nice dip that is anterior to the tendons of semitendinosus and semimembranosus. It's about 1 cun anterior to kidney 10. Liver 9 is located 4 cun superior to liver 8. We know the patella is 2 cun long, so we can use this measurement to help us calculate the distance between liver 8 and liver 9. Liver 9 lays in the cleft between the muscles sartorius and vastus medialis. Liver 10 is located 3 cm directly inferior to stomach 30 on the anterior border of the muscle adductor longus. Liver 11 is located 2 cm directly inferior to stomach 30 on the medial border of the muscle adductor longus.
Liver 12 is 1 cm inferior to Ren 2, 2.5 cm lateral to the midline. Ren 2, 1 cm inferior, 2.5 cm lateral to the midline, in the groin, medial to the femoral vein. Liver 13 is located just anterior and inferior to the free end of the 11th rib. To locate the free end of the 11th rib, palpate up the lower margin of the rib cage till you get to the first free floating rib, which is the 11th. This point is never inferior to the umbilicus and never posterior to the mid-axillary line. Liver 14 is 4 cm lateral to the midline in the 6th intercostal space. When you locate this point, make sure you are in the intercostal space, not on the rib.